Good morning. Happy New Year. My name is Ralf Friedrichs. I'm an author, addiction recovery coach, a life coach, and the host of this show, To Take Your Life Back radio show combined with the YouTube video part of it. Folks, 2019, let's not continue because the opiates are killing more children and teens today, a study says. This came from CNN. A growing number of children and adolescents in the United States are dying from opiate poisonings, a new study shows. Nearly 9,000 pediatric deaths were attributed to opiates from 99 to 17, according to a report published Friday in the Journal of JAMA Network Open. During the 18-year span, the mortality rate for youth due to opiate poisonings nearly tripled, my friends, tripled. Can you imagine that? Folks, what began more than 2 decades ago as a public health problem primarily among young and middle-aged white males is now an epidemic of prescription and illicit opiate use that has taken its toll on segments of the U.S. society, including pediatric population, and actually for the whole world. Millions of children and adolescents are now routinely exposed in their homes, schools, and communities to these potent and addictive drugs. Research released earlier last year in the journal Pediatrics showed that the number of children admitted to hospitals for opiate overdoses nearly doubled from 2004 to 2016. This new study set out to examine who's dying. Looking at these numbers, my friends, they're unbelievable. Of the 8,900 children and adolescents who had died from opiate poisonings over 18-year period, 6,500, about 73%, were male and 7,900 were adolescent ranging in 15 to 19 years old. Among the 15 to 19-year-olds, 3,000 deaths also involved one or more substances, such as benzodiazepines, cocaine, alcohol, or antidepressants. My friends, it has to stop here in 2009. Nearly 7% of deaths were children ages 0 to 4, about 4% 10 to 14, and about 1% were ages 5 to 9. That's unacceptable, it's unthinkable, and unimaginable. Non-Hispanic white children and adolescents made up the majority, nearly 80% of those who died. Hispanic youth accounted for more than 10% of the deaths, while non-Hispanic black youth were about 7% of the deaths totals. Prescription opiates accounted for 73% of the deaths, but heroin killed nearly 1,900 of those ages 15 through 19. The bulk of these opiate deaths, nearly 81% of them, were unintentional. 5% were suicides and 2.5% were homicides. But for children younger than 5 years old, nearly a quarter of the deaths were labeled homicides. Among infants, it was closer to 35%. The importance of the place that we carry education in this country has to be brought up more effectively in schools. Where children and adolescents died was also examined, since most other research has focused on results from emergency room visits, hospitalizations. The researchers said we needed to do this. They pointed to one study that determined that about 2,000 children a year were hospitalized for opiate poisoning between 1997 and 2012, and a small number, about 30, each year died while hospitalized. The new report, however, puts the number of deaths per year at closer to 500. The new study's authors found that most deaths happen away from a medical setting, with 38% happening in the homes. The researchers relied on data from death certificates, which they acknowledge might include some misclassifications of cause and manner of death. My friends, but even when possible limitations, they wrote, the problem for youth will likely grow unless legislatures, public health officials, clinicians, and parents take a wider view of opiate crisis and implement protective measures that are pediatric, specific, and family-centered. Last year, there were more than 70,000 drug overdose deaths in the United States, according to a recent report from the U.S. Centers for Controlled disease or disease control and prevention. And opiates were involved in 67.8% of those deaths. It has to come to an end here, now, 2019. Let's all educate our children. Call me at 844-405-HELP. Together we can help each other take our lives back. Be good to yourselves, be good to each other. A simple smile to a total stranger can make a difference in their life, can even make a difference in your life. And remember, we need to educate our children, but it also starts at home, my friends, in your house. Let's be role models.